Uh,
Hang on, can I just say, I'm not sure that's a good idea because we said if you don't want to be recorded. So welcome everybody to this public meeting organised by CASH. My name's Jean Fitzpatrick. I've been a member of the CASH group for 2 years. I live in the Ealing Southall constituency and I will be chairing this evening's meeting. Welcome to our guests, Council Leader Julian Bell, Greater London Assembly Member for Ealing and Hillingdon, Dr. Onkar Sahota, and Ealing Southall MP Virendra Sharma. Also with us is Araceli Camargo from the Centric Lab, Simon Ricks from the residents group living near the Lee Valley Gasworks development, and CASH members and members of the public and members of Southall community. Before we continue, CASH would like to extend condolences to the family and friends of Tony Pidgley, founder of the Berkeley Group, who passed away very recently. So I'm going to read the next bits because we are short of time. We could go on all evening, so I don't want to hum and ha and get it all wrong and get mixed up. So if that's okay, I'm going to read certain sections. So first of all, I'd like to start with the context of this evening's meeting. It's almost exactly a year since the last public meeting about the Southall Waterside development took place. It was held at the Dominion Centre and attracted over 200 people. There was then a large panel from various stakeholders, Ealing Council, Berkeley Group, Public Health England, etc. And these people addressed the meeting and answered questions. Cash is very pleased to be hosting this one tonight to give Ealing an opportunity to explain what has been done since the Dominion Centre meeting to address residents' complaints about the odour and health impact of the site. As people know, the site we're talking about is the old gasworks site, which has been known for many, many years to be very toxic in terms of its soil quality. These ongoing grave concerns about pollution have added urgency due to the COVID-19 pandemic and what we know about how coronavirus is affecting BAME communities disproportionately affected by air pollution. And I'm sure our three panellists, I know Julian Bell is very supportive of Black Lives Matter and supporting BAME communities. I'm sure the other two panellists are too, so this will not be lost on them. The community's concerns have caught the attention of local and national media and will continue to do so. So the format for this evening's meeting is as follows. Angela Fonzo will speak briefly about cash campaign position today. Then we hand over to Julian Bell, who will then be invited to speak briefly about Ealing Council's position on the ongoing pollution issues. Then we have Araceli Camargo will speak about Centric Lab's health study of the Southall community. Just for information, she is co-founder of the Centric Lab, a neuroscience laboratory focusing on how the built environment presents a risk of certain health issues. The Centric Lab recently conducted a 3-month study into the Southall community to investigate whether the Berkeley Group development had a role to play in the self-reported spikes in health issues for residents near the site. Its findings were published in a report entitled Air Pollution and Health in Southall, and Cash emailed a copy of this to each of our three panellists. So we hope they've at least had a chance to look at it and its recommendations. During the meeting, Cash members will put several questions to Councillor Bell, Dr. Sahota and Mr. Sharma. And as I said, at the end, there'll be 15-20 minutes for questions from the public. If you have a question, let us have it through the chat button. Keep them brief, to the point. The focus is on Southall Waterside and the pollution issues. We'll finish with Cash giving a closing statement, and Julian Bell then, I hope that's okay, will be invited to respond to it. So like I say, this is being recorded both by Cash and by the Guardian newspaper. So I think we've covered everything now. So without further ado, I'd like to hand over to Angela. Okay. So if everybody else can be muted, yeah.
Okay, good evening, everybody. Thank you for coming to this meeting. Cash came about because of the ongoing odour problems we've had since at least early spring 2017. And we started to notice, myself and a neighbour, that people were complaining on social media websites such as Next Door Neighbours and Facebook. And they said, I notice a noxious odour in the area. It smells of petrol, it smells of tar, it smells of diesel. And what was more concerning is that people were saying, I'm suffering headaches, I'm suffering nausea, I'm even vomiting. So the alarm bells started ringing, and it escalated to the point where a neighbour and I decided it was a good idea to actually set up a campaign group. Because he pointed out to me, and I was unaware of this at the time, that potentially there were carcinogens in the air that could cause cancer. And that really got me thinking. So Cash was established in July 2018. And we started campaigning quite vociferously. We leafleted the local area. And we held our own public meeting in August 2018. We were absolutely surprised by the number of residents who turned up to the venue. It was absolutely full. And everybody shared similar stories about how the odour nuisance impacted their well-being, the dust nuisance damaging their homes, and also homes close to the site suffering damage to their foundations due to vibrations. So beyond that, we continued campaigning. We met with Berkeley Group on 3 separate occasions. Once on the site, we were not happy with what they said and how they responded to our concerns. They seemed to be quite dismissive. We even went to their AGM in October 2018. We met the late Tony Pidgley. One of the senior directors came to visit us. It really made no difference to what we were experiencing, that any mitigations that they implemented didn't have the desired effect. Tony Pidgley also came to visit us at a resident's home. And on both occasions, the resident concerned had her back door open to her kitchen, and her kitchen absolutely reeked of petrol and tar combined. And it's something that Tony and his colleague, Carl Whiteman, seemed oblivious to. They promised to share the air quality data with us, but in actual fact, Tony went back on his word and said he couldn't do so because his insurer did not advise that it was the right thing to do. We also met with Julian Bell in the autumn of 2018 at a local Labour Party meeting. And we expressed very clearly what our situation was and how residents are being affected. Again, that didn't lead to any satisfactory resolution to what is going on. We also met with Mr. Virendra Sharma in October 2019 at his surgery, and he said, "I'm here to listen to you." And then he said, "As an MP, I will decide what to do and what action to take." We have been waiting since October 2019 to find exactly what action he has decided to take, and perhaps Mr. Sharma will share with us tonight what he has decided to do. We also met with Public Health England in February 2019 to discuss their assessment of Berkeley Group's air quality data. They were called in to assess Berkeley Group's air quality monitoring in June 2018. And at that point, Berkeley Group started monitoring individual volatile organic compounds instead of total volatile organic compounds. We weren't satisfied with the answers that they gave us. There was no reassurance that they were taking our health symptoms seriously. On the 10th of July 2019, as the chair has already expressed, Ealing Council held a public meeting, and there was a lot of representatives from Ealing Council, Berkeley Group, Public Health England, and the Environment Agency. I think I can categorically say that none of the residents were reassured by their stance that the air pollution was unlikely to be a long-term risk to health. In actual fact, I will remember this for the rest of my life, a resident calling out, "You killed my father." As part of our campaigning, we have walked along the local streets most affected. We've been along Beaconsfield Road numerous times, and we have spoken to residents whose loved ones have died from pneumonia. And when you look into their eyes, you know that they are still grieving. We've always campaigned peacefully, and we have been successful in obtaining widespread media coverage of our plight. So, as you are probably aware, we've been in the local press, in The Guardian, in the Daily Mirror, and on BBC London News. none of this recognition has changed our plight. However, we are now capturing the attention of scientists such as Araceli Camargo, who is here tonight, and academics who recognise in the climate of the Black Lives Matter movement that the people of Southall are experiencing environmental injustice. And this is a phenomenon that occurs in mainly Black and minority ethnic areas. And air pollution from Southall Waterside puts these communities at a higher risk of many health conditions and illnesses such as COVID-19. Now, I said to somebody I spoke to yesterday that if I lived as a Black person somewhere like Cobham in Surrey, where Berkeley Group has their headquarters, which is a predominantly white area and very affluent, it's very unlikely that I would be experiencing the air pollution I experience in my home in Southall. I would also say, as a Black person, I have never said that white lives don't matter, because the campaign group comprises people from many different ethnic backgrounds, including white people. And I will campaign for anybody, regardless of their racial or ethnic background, on this issue. In actual fact, we are united by this common injustice. I would also like to add, we are here today to put our demands that the air quality monitoring strategy, which has been funded by Section 106, must be in place, and there must be a proper investigation of the health crisis in Southall before the next phase of the development takes place. So I'm going to ask Julian now, Councillor Bell, can you please tell us Ealing Council's current position on the air pollution from Southall Waterside and what Ealing has done in the years since the last meeting?
Thank you, Angela. We had that public meeting in July of last year, and at that meeting the latest report from Public Health England was available, and that basically had monitoring results that came from the period up to March of 2019. Now, as you say, the problem had existed, well, certainly from acutely the summer of 2018, and that's when CASH formed. And at that point, we as the council contacted the Environment Agency that were responsible for monitoring the remediation of the soil that was taking place at that point. As a result of that, they rather frustratingly came back and said that Berkeley were going above and beyond what was required of them. The only thing that we managed to get from them was a additional amount of monitoring and also odour suppressant actions taken. Now, obviously, we were concerned about our residents' health, and that was always our first priority. So at that point, our public health director and myself as the council leader, we asked Public Health England to review the data. And that was what was available to us last July. Now, what that report from Public Health England said was that it wasn't likely that there was a long-term toxicological effect on the residents in proximity to the gasworks in Southall. Now, in order for us as the council to issue a statutory nuisance abatement notice on Berkeley, we have to be able to say that there is a likelihood of health impacts on our residents. And Public Health England were clearly saying to us in that report last July that was not likely to be the effect. Also, we had the Environment Agency saying to us that Berkeley were going above and beyond what would be expected of a company who were doing the soil remediation that they were doing. That put us in a difficult position in that we were not able to go forward with an abatement notice. However, we insisted that the monitoring should continue, and that report from Public Health England said that there were high levels of naphthalene and that they should be reduced immediately, and asked that Berkeley do so. Now, as I say, that data was from March 2019. So what happened at that point? The soil remediation actually stopped and was finished. It was completed in March 2019. And the soil hospital that was on site, that was decommissioned and ended its operations in April 2019. So the data that we now need to analyse and look for, and that will come in the latest Public Health England report that we're expecting very shortly, and that will give us the data for the last year. And certainly my understanding is that the levels of volatile organic compounds that have been detected in the monitoring, including benzene and naphthalene, will have significantly decreased since the decommissioning and ending of the work in the soil hospital. So we will keep, as we've always done, the option of reviewing whether or not there is sufficient evidence for us to serve a notice of a statutory nuisance against Berkeley. We wait for that next report from Public Health England, and we'll see whether or not that gives us any further leverage to do any issue a statutory nuisance notice. So, as my understanding is that there is no further soil remediation of significance on the Berkeley site, and the main amount of soil remediation that's still to be done is on the Cadent gas holder site, which is within Southall Gasworks site, but under a different company, Cadent. They have been in contact with the council about how they would do that. They're looking to do this in the autumn, but they're looking to do any soil remediation off-site, so it wouldn't be done on site. There wouldn't be a soil hospital in the way that Berkeley did it previously. And my understanding is that the way that they'll extract the soil will be in a way that it's covered and filtered, so that any air that comes out into the wider atmosphere will have been filtered and have any volatile organic compounds taken out of it. Now, as I say, we will keep all of these things under review. The Environment Agency will get back involved again when Cadent start to do soil remediation in the autumn, because they are the permitting body, that watches over those kinds of soil remediation activities. I guess the only final thing I'd say is that I've read the Centric Lab report, and I've written to Berkeley asking them if they will respond positively to the recommendations of that report. You know, we will certainly be wanting that to happen. In terms of a public health response to that Cadent report, Centric report, sorry, we will, as I understand that Public Health England have written back to Cash after receiving the Centric Lab report and referred it back to Ealing's Director of Public Health. So in due course, we will respond to the Centric report via our Public Health Director. Thank you, Jean. Right,
thank you, Julian Bell. Thank you very much. I think now we want to hear from Araceli. And I know obviously we've got Onkar, Sahota and Mr. Sharma here, but the following question after Araceli is going to be about health concerns. So maybe we can bring Onkar and Virendra in at that point, because obviously you're here and you are the panel, so we'd like to hear from you as well. So maybe we hear from Araceli now. If you can unmute her, Sufyan.
Yep, I think, can you guys hear me?
Yep.
Okay, perfect. Great. Well, thank you so much for putting this together, because first of all, clean air is good for everybody. So this is also a plight for London in itself to have clean air. So I wanted to just highlight 3 things from our study. We went in a different direction from the micro, specifically focusing on the 2 chemicals and relating those specifically 2 chemicals to the health outcomes. We did this for 2 main reasons. The first reason is that biology is incredibly complex. It's not an input-output mechanism. By that I mean is that it's not a simple case that whatever comes in is going to have a direct output on the other side. Therefore, to really understand how these chemicals are affecting the biological system, you would have to have a proper longitudinal, which means a long-term study, to be able to actually get to the bottom of that. However, the second reason is that we don't have that time, because we are dealing with people's real life experiences. We are dealing with people getting sick, and that was the priority of our lab, is to understand the phenomena, understand what was driving these poor health outcomes through understanding that biological interaction between air pollution and the human biological system. So that's what I want to make very clear, that was the role. And we did this speaking with Angela backwards and forwards. We changed the thesis a couple of times to really understand how we could best serve this community and how we can move the results quicker. So the first thing to understand is how air pollution affects the biological system. So it can have 2 strands. It can have a linear strand and it can have a systemic strand. The linear side is temporally short term. So we're talking that you take in the air pollution and immediately you could have, for example, you guys have been talking about the noxious odor, which I went to Southall and it's incredibly evident. And so your first reactions are, you can have a cough. I certainly experienced a coughing sensation. I experienced just the uncomfortability as well, that you knew that you were inhaling something that was had left you with a bad taste even in your mouth. And then you could have the itchiness of skin, itchiness of eyes, or irritation. And then we have to look at the long term. So the longer someone's exposed to this, which is something that has not been addressed by Public Health England or the Environmental Agency, which is incredibly important. If not, that is the crux and the fundamental part of this, is that the long-term exposure of this. Because with the long-term exposure, you then have the full dynamics of a person's environment and habitat, right? So it's these chemicals and how they're interacting with other stressors. And by stressors, I mean things that agitate the biological system, whether it's other pollutants that are in the air. So we do know that that area has high levels of traffic that it has to contend with. It has other forms of air pollution, such as Heathrow and the asphalt plant. So then you're talking about that these pollutants are not acting as a singular phenomena, as a singular event. Therefore, again, you can't just study it as input, output. We're just gonna measure how these specific toxins affect or do not affect people. It's the wrong way or the wrong line of scientific investigation in our, in our opinion, quite frankly. So when you're talking about systemic, you can then start to have systemic then biological or health consequences. So that's where you can have air pollution is known to have consequences to obesity, to diabetes, to cardiovascular, to the cancers that we've also been seeing, because it starts to degrade the system. It starts to degrade our biological system. And the reason it does that is whether it's linear or whether it's systemic, the stress response, which is one of our main biological responses to our environment and our environmental stressors, has to activate. And the main role of the stress response is that it reacts to the outside world or to the internal world, and it brings the body back to stability or homeostasis. So it tells the body, okay, we're gonna have to engage the lungs more, we're gonna have to heighten the blood pressure to go up, we're gonna have to, for example, if you got injured, it would go, okay, we're gonna have to deploy more blood to that area so that area can heal. All of this is negotiated through the stress response, and it speaks to our endocrine systems, our immune systems, in order for us to come back to a stability. But now what happens if the body constantly suffers injury or stress, which is the case of Southall, of every single day having to battle these different types of pollutant? What that does is that the body goes through something called wear and tear, and it's got a fancy word called allostatic load. And what allostatic load is that it's that degradation of the system. So then you have a deregulation of the stress response. And this is really crucial and important to understand, because with that temporal line going further down, you then get something called an amplification effect, which means that you only need smaller amounts of pollutants to come in for the body to then get irritated. So imagine it like a scale of weights, or that it just gets heavier and heavier and heavier, and therefore then you only need a small amount on the other side to continue that imbalance. And because that is simply how the phenomena of the biological system works, then you can see how it would be very, very difficult for the Environmental Agency or Public Health England to, I would say, safely prove that absolutely these toxins have nothing to do with the biological health outcomes of people, one. Two, the weight that they're adding, again, to the biological system has to be considered, and it hasn't been considered. So now I want to move on to the second point, which is susceptibility. So one of the things that we looked at from Public Health England and Environmental Agency, and just in general of how health agencies approach these types of problems, is that we say, well, only 1 in 5 of the residents have gotten sick. So therefore, we're not too sure if it is the air pollution that is to blame. Or maybe only, let's say that only one person in an entire street gets affected. And we dismiss it because it's got a quote unquote low stat or low ratio. However, when it comes to health, we cannot take that risk. That is not the framework that we can take when it comes to health, because just that one person, number one, matters. Number two, if it's already affected one person, with time, it's going to affect more people. So we have to knock these phenomena, nip it in the bud, as we say in America, at the very beginning. And so with susceptibility, you have some people in the neighborhood who maybe have come from tougher economic backgrounds or have more economic vulnerability, so they are living and they're experiencing poverty. And of course, you have all the way to people that are comfortably in a middle-class background. You have everything in Ealing. But the people that are also experiencing poverty have another weight of stressors that they're having to deal with, because the body, as I said, response to stress, and it can be physical as in air pollution, but it can also be psychosocial, coming from the experiences of poverty. The other important thing with this community now is that the burden and the stress actually of having to campaign, of understanding that you're having an injustice happen to you, to understand that your biological system is telling you, this is why we have our olfactory system. Our olfactory system is there to detect danger that our visual system can't. So it is telling these people in this community that there is a danger because of that toxic air. And so that is also a stressor. It's also a stressor to see your community have members pass away and get really sick, or watch your children get sick. That's also a stressor. So with that, with the more time that passes with this exposure, you're not only increasing their exposure to the toxin, but you're also increasing the stress levels of combating that phenomena. So again, you're degrading, you're piling the weight on that system, so you're making people even more susceptible to disease. And one of the things that we put in the report is that this has been very widely studied in epidemiological and neurobiological studies, that people that come from impoverished backgrounds, because of something that we have coined in our lab called biological inequality, so experiencing high levels of stress, they don't need as much toxins to get sick. In other words, air pollution or the toxins are more poisonous to them than in a system that is healthier. And actually, that's exactly what we're seeing with COVID as well. And so that is another phenomena that Public Health England and the Environmental Agency have not taken into consideration, and it's incredibly significant. And then the final point that I want to look at is the World Health Organization, which is an agency that's been quoted by the Environmental Agency, and you do feel like they're passing the buck a bit, right? So these air pollution guidelines are set by the WHO and these bodies, but they're guidelines, and it's really important that we understand language and vocabulary. A guideline simply means that it's within a scope. It is not a rule, and it's not set in stone. And in the recent WHO air pollution manual, it says that this is a guideline. This is the minimum that we're asking you the maximum, that you can have in a community. However, it actually stipulates that susceptibility, the phenomena that I just explained, has to be taken into consideration when putting guidelines into a specific community. And I don't hear that neither Barclay or Public Health England or the Environmental Agency or Ealing Council did that level of due diligence. Therefore, to me and to our report, is that there is a failure across that entire supply chain. And then the final thing in terms of the WHO is that it tells you that you constantly have to monitor. You have to monitor the susceptibility of the community and see what other stressors are coming into the community, because it's a habitat. A habitat constantly has new things happening to them, and also new people coming in, and the dynamics change. So this isn't something that can be seen as a set in stone standard. This is something that has to constantly be monitored and changed. And then my final point is that we can't just treat people like statistics and numbers. We can't. If the lived experience is telling us that there is something in that environment that is making people sick, that is our priority to follow. it's not the priority to follow numbers. Our priority to follow is the experience that people are having. And there is absolutely indisputable that this community has gotten higher levels of hospitalization, has gotten sicker since the development has started. And that is something that we have to be, as scientists or as statisticians, we have to be really empathic about. Sorry, I lied. One last point from the WHO, which is that in the WHO, they're also very explicit that there is no safe level of air pollution, not one. It's zero air pollution is the safest level that you can have. So I don't know what this means in terms of legality and policy, but if the WHO is telling you that there is no such thing as a safe amount of air pollution, already they're coming and breaking a biological rule. If not a legal one, they're breaking a biological rule by exposing people to these these toxins. Okay, I'm done.
Right. Thank you very much, Araceli. As a non-scientist, I think I followed every word. So thank you very much indeed. And I've not met you before. It's a great, great pleasure. If you can bear with us, we have got Sufyan is going to ask a few questions about health, which links to what Araceli has just said. And then I want Sufyan to unmute Mr. Sharma, Mr. Bell again, and Dr. Sahota, because there are questions to each of those three. So, Sufyan, would you like to make your input now?
Hi there.
And then unmute our three panelists?
Yeah. So, hi there. I'm Sufyan, one of the youngest members of CASH. Been with the organisation for about a year and a half. So, yeah, as Jean said, I've got three main questions, but just a bit of background before we get onto them. So, in CASH's own research, our research tells us that the complaints of ill health since the work started are widespread and ongoing. Many residents have offered to show us medical records with detailed visits to the GP and hospitals. Air quality expert Professor Harrison said levels of chemicals presented a threat to health. And PHE's own assessment last March said levels of naphthalene need to be urgently reduced to protect long-term health. A leading toxicologist has told us that symptoms may be caused by naphthalene, poisoning, and we know that the levels of naphthalene have been exceeded the safe levels. The Centric Lab study has studied the community and highlighted our vulnerability to air pollution. But Ealing's only response so far has been to publish an asthma and cancer data that does not go far enough and does not prove there is no health impact. So our question to Julian Bell is, what does Ealing plan to do now to properly investigate the health impact on this site? Yeah, Jean? So
yeah, could you perhaps unmute all three?
Okay.
Yeah, at this point maybe, because and then we can ask the questions Dr. Sahota and Mr. Sharma. But anyway, can you unmute all three panelists?
Yeah, but I've unmuted them, now they need to accept. So that question was just directed at Julian.
Yes, that's right, that one, yeah. And Dr. Sahota, sorry, Sufyan.
Oh, you want me to go? All right, yeah. So our question to Dr. Sahota is, with your medical background, what do you think, or what do you suggest Ealing Council does to investigate the health crisis in Southall? So Julian, Mr. Councillor Bell?
Yeah, thank you, Sufyan, for your question. You referred to the Public Health England report, which said that naphthalene levels needed to be reduced. And that was from March 2019. And and they said it needed to be reduced urgently. That's what's happened. The soil remediation at that point ended, and the soil hospital was decommissioned because the work had been completed. So that was the response that was made. Now, obviously, we need to make sure that the reduction in levels that we are led to believe have happened since the soil hospital was decommissioned is actually happening. So it's critical that we get that fourth report from Public Health England. I'm told that that will come to us shortly, and obviously we will study that very carefully, and we will look at that and decide whether or not we are in a position to issue a abatement notice because of a statutory nuisance. I have to say, I don't think that that's likely, because the work, as I've said on a number of occasions, the soil remediation work has finished. When it was at its height, that data that Public Health England analysed, they said that there were some short-term levels of benzene and naphthalene and another VOC that I can't pronounce. But in order for it to be likely that there was a toxicological effect, these had to be long-term average levels for a lifetime. So these were very, very short time-limited incidences of spikes above the World Health Organization levels.
Sorry, to cut you off, but my question was, what does Ealing plan to do in the future now to investigate, to properly investigate the health impact? Because the damage is done. Now, what does Ealing plan to do to investigate?
Well, I've said to you that we have asked Public Health England to give us their expert advice. They are the experts when it comes to these kinds of health matters. So we're waiting for their fourth report, and that we will study very carefully, and then we will look to act on what that report tells us.
So, Mr. Bell, I mean, I'm sure you were present as I was listening to Araceli making her presentation. I'm not sure you made any reference to anything she said in it, but could we pass on to Dr. Sahota now? Because I know you're very concerned about across London, maybe in your role as GLA member, about the responsibility local councils have where the buck stops.
Yes, great. Thank you, Jean. Thank you to all the members of CASH, and thank you very much for inviting me this evening. I have found the contribution by Araceli very informative. And the human body is a biochemical system, and it is a system which responds to different ways. And I think if we've learned anything from COVID-19, it has been the impact of inequalities. We have found that those people in society who are most vulnerable, who are most economically prejudiced, are people who are in low-paid jobs. They're the ones which have suffered the most. My starting block, right, and the question was, what would I want the Ealing Council to do, or what I would want to happen across London? My starting point is that the symptoms of patients are real. The symptoms of these people are real. And we should have our framework of how do we start explaining what's happening to our population. And the starting block should be that we should be getting independent monitoring of the air quality that was coming out of Berkeley Homes. We knew from day one that this was a site which was contaminated. We knew this is a site which had been a gasworks site and a petroleum-based gasworks site for a long time. And we, in fact, objected to its development. The residents of Southall were not keen on its residence. we should have had a high index of suspicion about what's going on there, and we should have commissioned independent air quality. So the first thing I would want to do is I want to make sure that the burden falls on the local authorities. And I wasn't able to go backwards. This is no consolation to Southall. But what I did at London Assembly was to enforce, right, that it will be now put into the planning framework that if any other contaminated sites are given permission in London, it will put the onus on the local authorities to do the monitoring rather than leaving to the developers who can then go to independent contractors. So I think that's the first thing I would want to do, is make sure we have independent data. And I'm not sure that the report, which the public health is going to deliver, is based on independent readings, or is it just reading given by the developer to the public health? So that's the first thing I would want to make sure. And second thing I want to make sure is that we need to look at impact of air quality, and air quality is a very important determinant. I know that Sadiq Khan and the London Assembly have been working very hard to improve air quality. And one thing that COVID-19 has done is improve air quality right across London. People can now breathe much more easily and much better because the pollution has gone down. But I would want to say, if my population, whether it's my practice population or my population of my town or population of my area, if they're complaining of symptoms, then I should be looking into the research, right? Say, why are they getting these symptoms and what can I do about it? That would be my starting block. What I found in this whole episode is that there seems to be no one who takes responsibility. Public health have their guidelines, environmental agencies have guidelines, local authority have guidelines, and they all point the finger to that the local authority should be taking responsibility for this. But I think no one has come out of this situation clearly, and no one really has a clear marcation of where the buck stops. And that's what I have made sure that from London we do that in future. But that's what my starting block is. See, get independent data, get assessed in the context of my population, and see what is going on in my population, why are these people complaining, and what can I do about it, rather than saying that we accept what's being given to us on a plate.
Okay, thank you, Dr. Sahota. Sufyan, would you like to ask Mr. Sharma the final question of this section?
Our final question is directed as our local MP Virendra Sharma. Now, Mr. Sharma, my question to you is, what have you done about this issue since we last visited your office in October, and you told us that you would do something about the ill health in the area?
Thank you very much, Sufyan. Thank you very much for organizing it and also inviting me. And I also fully share the concerns of you, other members who had direct experience, and the community. I fully agree. I always believe that we need to work together to make sure that a solution is found. That's why I have written, which my office has shared it with some people, that I have written to Public Health England, Berkeley Homes, the Environment Agency, and I understand that Duncan Selby from Public Health has written to Ealing Council in response to my inquiry to find out best solutions to do that, and also to make sure that other things are done. I have spoken to Berkeley Homes, putting pressure on them to do it. I hope that I'm not in a negative sense saying Tony Pichele is not there anymore. There's changes. I will be still waiting for the response from what I have written to Berkeley Homes, and also waiting for the response from Environment Agency to make sure that we take it further. So I will be working together. I take the recommendations. I was very informative speech from the scientist who done the report. I will be working with CASH and other agencies locally. I will be asking questions to Ealing Council. But one thing is that I don't have direct role in former role in the planning side, but I certainly, the clean air, environment clean, other people on the health matters, I will be working with all the agencies together to find a solution. That's what I have done so far, and I will carry on doing it with the friends and the groups in the local area.
Okay, thank you. Yes, I remember the meeting we had in your office very well, Mr. Sharma. You said you were listening, and one of your assistants took a lot of notes and promised us action, and maybe writing to people and making sure they write to someone else is action, but maybe I think Cash is asking for a little bit more. So let's move on now to Amrik, who's got a question about air quality monitoring. Amrik. Can you unmute Amrik, Sufyan? Technical hitch.
Yeah, I've just tried to find
There
it.
he is,
Got
there
it.
he is.
Got it. Got it.
Right, okay, Amrik.
Hi, everyone. Okay, so we've been going through this health concern for the last 3 years now. And one of the main things that Ealing Council, Public Health England haven't done is proper air quality monitoring. All the monitors were taken down from outside, including the school at the top of Beaconsfield Road that was decommissioned due to reasons only known to Julian Bell, the council, and others who made that decision. We, Cash, installed 4 monitors around Beaconsfield Road area, and we had some interesting results, which I did pass on to Ealing Council. Ealing Council wanted to know where the monitors were. We refused to tell them where they were, but we had some really good results showing high levels of toxins being released into the atmosphere from the work area. Now we know our results and the numbers we got are true because we measured them against other measurements that we had going on at the same time. So we know we had all these measurements done. Mr. Bell, for 3 years, people in Southall have been suffering. Some of them have had, in layman's terms, Berkeley's knees on their throats for 3 years because they can't breathe. You quickly took to Black Lives Matter, and within, it seemed like minutes, you were changing road names. You were complaining about statues and other things. But people in Southall have complained for 3 years that we cannot breathe. Why is it taking you so long to listen to us? You also said in a letter to me that short-term health problems are far outweighed by the need of houses for the community. You also said at the Perivale meeting that I attended with you that I asked about the £700,000 that was given. You said you spent it somewhere else, but hey, that's down to you. We can't breathe. We really can't breathe. The report done, the young lady who's just told us about it, just shows how much Ealing Council, Mr. Sharma, don't care about residents of Southall. They really don't. Had you cared for us, you would have done something at the beginning. It's easy to pass the buck between yourselves, Public Health England, and the government and London councils. But you all failed the people of Southall. All of you failed us. People have died. Their blood is on your hands. Nobody else's. Their blood is on your hands. You killed those people. Nobody else did it. Berkeley made their homes, but you had the power in your hands to stop this building and to stop this poisoning of people in Southall. You failed in your duties as council leaders, as an MP. You failed in all that. Mr. Sharma, we wrote to you, we met you a year ago, and only now have you said you've written to other people. After nearly 9 months, yeah, I know for a fact people have written to you about this anti-abortion laws that were coming in. You replied, in some cases, in as little as 4 hours. Your officers were replying to them in as little as 4 hours. Why couldn't you do the same for us as cash? Why couldn't you look after the hundreds and thousands of people who have been complaining to you bitterly, to the council bitterly, saying we are suffering? It's your residents. It's the people who voted Labour. It's the ones who keep voting Labour. Doesn't matter who stands for Labour. They don't vote for the person. They vote for Labour because that's all they understand. That's all they want. It's a Labour MP. They don't want you. They want a Labour MP who will stand for them and their rights and protect them from the people like Berkeley who are ruining our health. Where is your support for the residents of Southall who vote Labour year in, year out? You are supposed to be our spokesman. Where is your supportive voice? Mr. Bell, you know, you keep promising all these data, all these monitors and things, but nothing's going to come. You already said the naphthalene level's gone down. It went down because they stopped the works. It's quite simple. If you stop something, the levels will come down. It might take a few months, it might take a few years, but the levels will come down because you've stopped the work. Well, not you, Berkeley has stopped the work. There is only air monitoring data reviewed by Public Health England and the Environment Agency. Public Health England says it's Ealing's responsibility to act on the recommendations of its data. I ask you, Mr. Bell, as the young lady from earlier said, data doesn't really matter. If people are saying they are suffering, if people are going to the doctors, if the children are suffering and they can't breathe and they week in, week out, they're going to the doctors, what good is data? Doesn't health matter? I leave it to you.
Thank you, Amrit. Can I just make the point that much mention has been made of data collected by the monitoring that has been done, that Public Health England has analysed, and it's been read in, it would appear in different ways, but monitoring is not taking place, and the monitoring that was done was not independent monitoring, was not independent monitoring. It was done by a company employed by Berkeley Homes to get statistics. Now, maybe people in Southall, in our constituency, in the borough, shouldn't be cynical, shouldn't wonder if those statistics are worth anything, if that data is worth anything, but it has crossed people's minds that maybe if it had been independently monitored, I think which Dr. Sahota is asking for, maybe the information would have been very, very different indeed. So I'm just mindful of the time. It's 8:05, and we've got a few more questions from Cash, and then we've got quite a lot of questions coming in on the chat group, which everybody can see if you look at it, and we're going to make a copy of it so it won't be lost. But I'm just wondering if any of the three panelists can make a statement about independent monitoring.
Yeah, I'm happy to answer that, Jean. First of all, thank you, Amrit, for your contribution. The air quality monitoring station that was near Blair Peak School was a traditional air quality monitoring station which deals with nitrogen dioxide from car and vehicle emissions, and so it wasn't suitable for the VOC emissions that were coming from Southall Waterside. It had come to the end of its life, that's why it was removed. But we continued to monitor nitrogen dioxide levels in Southall because air quality is a priority for us. You also referenced £750,000, I think, in terms of some Section 106 monies that we were given for a low emissions strategy. So, and Angela referred to this at the beginning of the meeting. So I think, first of all, let's be clear, there has been air quality monitoring of the site right from the very beginning. I'll come back to whether it was independent or not in a minute, but absolutely there has been air quality monitoring. It continues, and that is absolutely right and proper. In terms of what that 750,000 for, we always intended for a low emission strategy to be implemented with that money once there was large scale residential occupation of the site. And so we have, we're in the situation now where we're procuring that air quality strategy and monitoring with that money, and that will start from August of this year. That's in addition to the air quality that's been done by Berkeley throughout through Atkins. Now, Atkins are a world-renowned air quality business. They have a reputation to keep. They are independent and separate from Berkeley. Yes, Berkeley pay, and you know, if the council was responsible for this, then Berkeley would have to pay the council, because I don't think it's right that council taxpayers should actually pay for the monitoring of a developer who ultimately is going to take profit out of that development. So, you know, that's the situation that we have at the moment, where there are expectations of developers like Berkeley to get a independent monitoring expert to do that monitoring. That's what they've done. That's the data that we have to go on. I think I'll end at that point.
Okay. So just to be clear, Mr. Bell, you're standing by the fact that Atkins is totally independent and there is nothing for residents to be worried about.
Certainly, I've got confidence in that monitoring data that Atkins have produced, yes.
Okay, we can quote you on that, thank you. So now let's pass on to Jan Griffiths, because we've got a linked question really, I think, Jan. Can you unmute yourself, Jan, or Sufyan? Jan, can you unmute yourself? Sorry about this, folks. She's Griffo.
Yeah, sorry, I'm just looking. I've looked for her. Yeah, I found her.
She's Griffo.
Yep, found her.
Thanks, good.
Can you hear me?
Yeah.
Good evening, everyone. Yeah, my name is Janet Griffiths. I'm a resident of Southall, have been all my life, and I've been a member of CASH for the last 3 years. I, as a resident, have suffered with these toxic fumes, as did my late mother for the last 3 years. As many of you know, my mother died of cancer, diagnosed in October and died in January, and I'm adamant that the fumes from the site contributed to this. Anyway, I think we've gone over a bit of this with Mr. Bell about my question is about the Section 106 money that Ealing has been given for this development. As we've said, Ealing has received almost 700,000 for air quality admission strategy for this development. CASH has requested on various Freedom of Information reports regarding this money, and the agreement clearly states the statutory should begin when there was built environment on the site. Residents have been living on this site since May 2019. We, as CASH members, have visited on numerous occasions the residents on this site who have complained to us about the fumes, etc., that they have been subjected to. A year ago, Ealing said at the public meeting that Ealing has not had time to come up with a strategy. In February, again, Ealing said they were looking for a consultant for this position. The Blue Gas Tower and the land it sat on is due to be remediated in the coming months, as you've stated, Mr. Bell. Cash demands that the work on this next phase does not begin until we receive written assurances that monitoring will be in place and that residents will not be subjected to the same chemical overload and pollution as before. My first question to you, Mr. Bell, is on what date will Ealing finally implement the air quality monitoring statutory called for in the Section 106 agreement, which I think you've covered? And why, if Ealing is so sure that this site is safe and that the soil that has been remediated is now clean from the toxic chemicals, why doesn't Ealing use some of this money to independently test it and prove to residents it is safe? Because us as residents, we are still experiencing the smells, the toxic smells from this site. So my question is, what is causing it? And my final question is to Virendra Sharma. Do you have anything to add to this? Thank you.
Thank you for your question. I think I covered it in my last question, in that this is an independent consultant who we've procured to actually deliver this air quality strategy and monitoring, and it will begin in August. Obviously, we have asked and made clear to Berkeley that they should continue to do their monitoring, and also with Cadent and the gas holder site, we would want to ensure that there is adequate monitoring around that site as well when that work goes ahead. And that again will be, as I've said, will be subject to the Environment Agency's permitting rules, and they would want to ensure that all of that monitoring is in place as well.
You've not answered my question about why is the soil still smelling if the remediation has finished?
So my understanding of that is that although the soil has been remediated, there will be some residual odour, but that doesn't mean that the soil hasn't been remediated. As I say, there are still some small pockets that will require remediation at some point, and also the Cadent gas holder section will be. But the soil hospital has gone, and that won't be coming back. And so my understanding is that although it's been remediated, there is still sometimes an odour. So at the moment, Berkeley are looking in the process of moving some soil which is safe and has been remediated from the western part of the site to the eastern part of the site. They were already 4 weeks into a 6-week programme to move that earth in order to build up the bank for that eastern exit road from the site. Now, my understanding is that if there are any odours from that moving of the soil, we've asked them that they would stop at that point. But again, every time we get any complaints about odours, we will send our officers down there, because we have a statutory duty and a moral duty to make sure that we are doing everything we possibly can to find the source of the odour. And I have to say, sometimes that's very difficult, because as Cash's name implies, there are problems in Hayes as well as Southall, and FM Conway and Tarmac also are producing odours. And so that's one of the problems that we face in issuing a statutory nuisance notice, is in that we cannot always find the origin of some of these tarry like smells because of the other operations in Hillingdon at FM Conway and Tarmac. But certainly, we will investigate any complaints about odour, and see if we can find out. We immediately talk with Berkeley to find out what they are doing and why that smell may have occurred, and that will continue to do.
Right. Thank you, Julian Bell. Maybe we could, I'm just very mindful of Mr. Sharma. Do you want to make a point?
Yeah,
Please
very
do,
quickly.
yeah.
I think that, as you said, Dean, that in view of the time constraint, one request I'm going to make to you, that I will send you the letter in response to every question raised by Amrik and few other colleagues here. And I want you, if on the list, you can pass on that letter, or if you could give my email to them and they can email me, I can send it to them. The letter with full details, what I have done, what I think should be doing at present, and what we expect from both Ealing Council and the agencies working in this area, and Berkeley Homes as well.
Okay.
As far as their, I will give you all in writing and in details. If you agree with that, it will be help to all of us that what is my views and what I think should be happening in the area. Is that acceptable?
I'm sure that would be, and maybe more actions too, because at the end of the meeting, we are making certain
two things.
Asks.
Yeah,
okay.
The monitoring, I still believe, should be independently done.
Exactly.
We Berkeley Homes should be paying for it, but we should be, the cash should be hiring the independent agency to monitor it, but paid by Berkeley, so that because they are getting all the benefits, they get everything, financial benefits, so they should be paying for it rather than anybody else. Okay. And I will certainly push that wherever it is possible. And I will be responding in details on all the questions, and any nuisance in the area should be stopped immediately. And I will work, I always work with all the agencies, but certainly work with everybody else if there's any way we can clear this mess in the society here.
Right. So Onkar, maybe just fair to you, would you like to make a brief comment on this before we ask Angela to?
Yes, thank you very much, Jean. First of all, look, I think we need to get this word independent very clear. I think Virendra and I are on the same page now, right? And I've been saying this for the last 2 years, that the developer should pay, but it should be commissioned by local councils. The results should go directly from the monitoring firm, from the consultancy which is doing the monitoring, and to the council, rather than going to the developer. We can have no credibility, we can have no trust in those readings until there is a clear passage from that agency who's been monitoring it, and the results go directly to the council. And what has happened so far, that data has gone via Barclays, right? It may be trustworthy, may not, but the question of credibility is lacking. And I'm really glad, right, that we are on the same sheet now, that something I've been writing about for 2 years, that there's no consensus that we will be getting independent monitoring, where Ealing Council is commissioning it, the results go to Ealing Council, they can then share it with the other agencies, and not going to via the developer. And that, I think, is a great shift if we can get that.
Yeah. Okay. So can we just move on to Angela, who is going to make a point about maybe inconsistency or consistency of enforcement, but also maybe, Angela, you could mention about, Julian Bell talked about whenever there's been a complaint, the council follows up very quickly. And I'm wondering if you could comment about how people are complaining or not complaining anymore, because it seems to fall on deaf ears. Angela?
Yeah, sure, Jean. We have always encouraged people to complain via the official channel, which is to telephone the Noise Pollution Service. I consider myself reasonably well educated, and half the time I don't know which button to press to actually report an odour nuisance. It's quite complicated. I read a tweet by somebody who said that people ask you to use the official channels, knowing full well they will never work. It's possible, if you want to complain about other council services in this day and age, that you fill in a web form. That's not possible with odour pollution. So people have complained time and again, but because there's underreporting, because it is difficult to report, Ealing Council have turned around and said, well, not many people have complained. And this is simply not true. People get fed up, they get tired, they get frustrated because they may well on occasion have a council officer come and visit and observe the odour. Sorry, excuse me for 1 minute. Can you deal with this? Sorry, apologies about that. Yeah, so they complain. They've had the council officer out to investigate. I can remember one occasion, it was so bad in the winter time, not in the summer, but in the winter, it was excessive. They came to visit. They walked down Scott's Road, where I live. They could smell an odour. Around the back where I live, they could smell an organic odour. They said it was, sorry, not arsenic, sorry, another chemical that I've forgotten. But certainly at the front, it smelt very tarry. Ammonia, sorry, it was ammonia they could smell at the back. And it was very tarry at the front. And that made absolutely no difference. I've had at least 5 visits from council officers. So people do complain, but they've become fatigued with it because nothing happens. And Julian will say, ring this number, knowing full well it's not going to lead to enforcement action.
Do you want to mention a thing about the other company in Southall?
Sorry, which other company?
Your question about...
Oh yeah, sorry, yeah. Yeah, my question is about the inconsistency that Ealing seems to display on enforcement action. I've lived in Southall for many years now, and you get to know people campaigning. And I know over the last 2 years, people have complained who live down Scott's Road, the end near the junction with Sussex Road, and also residents on Sussex Road have complained about an oily odour, which I've smelt myself walking around the area. It smells like chip fat oil. And that's because there was a company down the side road adjacent to Western Road called Proper Oils, recycling oil. Now, I know from communication that the council sent to local councillors, and it was prefaced odour nuisance, that they were informed Ealing Council had served an enforcement notice on Proper Oils for the company to cease and desist from processing of oil by 1st of May 2020. And it was made clear in this communication that if the company didn't comply with the enforcement notice, that they would face court action. See, what I don't get is Berkeley Group has been polluting people for over 3 years, to the point where we are believed by people who are non-residents, media people, who've come and reported the story. So I don't get why a small company, which as far as I'm aware, there was only one media article about them, have been served with enforcement action. Why not Berkeley Group? And it leads really to the assumption that possibly Ealing Council have turned a blind eye because of its partnership with Berkeley Group. We know that Julian Bell and Peter Mason have been to the MIPIN conference in Cannes, and that's paid for by Berkeley Group, along with other property developers. So has this affected their ability to protect residents and serve the residents they've been elected to do so? I would also like to know, Julian, did you meet with Berkeley Group online before this meeting? And if so, what was the outcome of this meeting? So over to you, Julian Bell.
Yeah, thank you, Angela. So, no, I didn't meet online with Berkeley Group before this meeting. In terms of the proper oils situation, there was a clear breach of the planning rules at proper oils, and we actually served, it was planning enforcement. So it wasn't a statutory nuisance notice that we served, it was for a planning breach, and it was planning enforcement that was invoked in that situation. Where we have the evidence, then we will act, and there's no question about that. And that's whoever it is, wherever it is. So if there was the evidence that we could take action for a statutory nuisance abatement notice against Berkeley, we would have done so. But consistently, Public Health England and the Environment Agency, and I have to say our own officers, professional officers who deal with air quality and monitoring of these kind of soil remediation actions, have always said to me that there is not a case for us to do this. Now, frankly, I wish there had have been, because I, like you, am very unhappy about the situation. But it seems we don't have the powers. Picking up on what Virendra Sharma and Onkar Sahota have said about the monitoring, if Atkins sent us the data direct rather than it going to Berkeley, I would welcome that and be very happy with that. And that's maybe something that we should look to change, because the rules are such that that isn't the way it works at the moment. But that certainly would be an improvement. In terms of
Bell, can I just say, I think that the suggestion from Virendra and Onkar was that actually you, or maybe I think Mr. Sharma mentioned involving cash in choosing an independent monitor that we then get Berkeley to pay for. That seems to make eminent sense to me. Well, then there is no conflict of interest whatsoever.
That's a question to put to Berkeley. If Berkeley were willing to do that, then I would be very happy with that. I think that would be a sensible way forward. Okay. Angela talked about complaints, and I just wanted to let people know the number of complaints that we've had. So in 2017 we had 79, 2018 51, 2019 82, and 2020 currently we've had 38 to date. But we attribute where, from wind speed and weather patterns, where the odour is coming from, and some of it is Southall Waterside, and some of it is FM Conway.
Can't prove beyond doubt it's Conway.
Sorry?
You cannot prove beyond doubt that it's Conway.
No, and that's the problem, Angela. We can't prove that it's and that's in terms of serving a statutory nuisance notice that would be successful. We have to be able to say without doubt that this is where it's emanating from, and that this has been the problem the whole way through. But the point of me reading those is that those complaints have reduced, and I would suggest that that's because the soil hospitals closed and the soil remediation ended in April 2019.
Yeah. Can I just intervene? I'm very mindful of the time. I think we're slightly going round in circles a bit, and Cash, really want to hear from members who've joined us on Zoom. I've got a question, if I may do that before I don't think we want to go beyond 9 on this Zoom because it can be quite tiring. A question, a statement really from David Marsden I'm going to read out, but there's Rena who would like to ask a question. I don't know if Sufyan, you can locate her, to unmute her. But while you're doing that,
Just give me 1 minute, I'll look for
yeah,
her.
okay. So while Sufyan is looking for Rena, who has a question, this is from David Marsden, who lives in Southall. And I think it's probably been covered, but he says, which chemical is causing the smell of petrol? And is it acceptable to gas people in their own homes and gardens to the extent that they repeatedly and angrily complain at the loss of enjoyment of their family life and the loss of their quality of life and the loss of their health and well-being? For 3.5 years and more, we have been telling you, Ealing Council, that we can't breathe. Why is no one listening? So that's a heartfelt statement, a few questions from one Southall resident who's been very involved in cash.
I've unmuted Rena.
Okay, Rena. Where are you, Rena? Can we see Rena?
I don't think her audio is working because she's unmuted.
Can we ask her to log out and log back in?
All right, okay, all right. Can you do that, Rena? Okay, so on the group chat, which everybody can read, so I don't know if people are flicking through the comments and questions, but we are making a copy of this. It's very easy to do, and all the questions that are on here that we haven't had time clearly to answer or cover today, we will be sending to certainly Julian Bell, the council, and maybe Onkar and Virendra Sharma. There was one question from Oliver New, which was about, is Oliver here?
Yeah, I can see him.
Yeah, could you ask one of your questions, Ollie? Is Oliver here?
Jean,
Yeah.
Rena is here.
No, okay, that's a shame. Is Oliver here, Sufyan?
Yep, so I've just unmuted Oliver.
Hello.
Oliver, can you ask one of your questions? Maybe about the one there was supposed to be someone employed by Barclay to monitor, and what's happened to that?
So I have two questions, and I suppose they both for Julian Bell. One is, as people may know, there was a huge campaign, both for under a Labour council in Ealing and then under a Tory council in Ealing to try to stop this development. And the main focus was around carcinogens. Eventually,
no, just leave the phone.
Sorry? Eventually, although two different councils on two occasions voted against the development, the Mayor of London, who was Boris Johnson, forced it through. But we did get some concessions, which have been referred to earlier, because of the feeling of local residents. One of those concessions was that the developers would pay Ealing Council for an environmental health officer to monitor what was happening. So it would be very good to see what the thoughts, what the results of that monitoring was. Secondly, at the time we had all of that campaigning over these years, we were being told that hundreds of tons of carcinogenic soil would be dug up, put on lorries, moved through populated areas to be remediated. Later on, we were told, no, that's not necessary. It can all be done safely on site. But what I understand from tonight is that soil will be dug up near the gas holder, and I'd like to know how that will work, where it will be taken, where the remediation will take place, will carcinogens go into the air if it's being dug up? How will it be ensured that those carcinogens won't go down into the water table when there's a huge disturbance to the soil? And it would be great to get some answers on those questions.
Mr. Bell, do you want to answer that, comment on that? Because that question will be sent to you, you know, for maybe to be answered in 2 or 3 weeks by, but Sufyan, do you want
Yes,
to
sorry, I was muted, so
yeah.
I was wanting to come in. So in terms of the question about the environmental health officer, that's my understanding, Ollie, is that is part of the Section 106 money, the 750,000 that we've been talking about. And as I've said before, that will start in August. In terms of the Cadent gas holder works, let me just read to you what their processes will be. So their methodology involves the use of an enclosure with negative pressure and filtration system, which means that any gaseous byproducts discharged into open atmosphere will have been thoroughly filtered stroke cleansed. All soil treatment will be conducted off-site, so there will be no new soil hospital. As to where it goes, Ollie, I can't tell you, but it will be done on the site when it's dug up in an enclosed area.
Right. Okay.
Jean?
Yes.
Could we go to Rena now, please?
Yes, Rena, where are you? You're back. Where is Rena?
Has Sufyan unlocked her?
Yeah, so her audio is on, but her camera's not. So.
All right.
Can she just read out?
Yeah, she can read out.
Yes, yeah.
Without us seeing.
Yeah.
Could you ask her to go ahead?
Yep. So Rena, if you want to take the floor.
We can't hear.
Yeah, she is unmuted, so
Yeah.
I don't know, maybe there's a technical glitch on her side.
Okay. Rena, if you don't mind, because of the technical glitch, I'm going to read out what you sent to me, and I think it's really powerful.
Yeah.
Hi, my name is Rena Bimb, and I am a local resident. I would like to start by saying that we are on the cusp on what could be the biggest environmental offence and negligence case seen in Britain's history. If further evidence is found linking health risks like cancer to the release of dangerous chemicals from the site, Southall Waterside is the largest brownfield development in the UK, and no model exists for developing a site with such a range of dangerous chemicals next to homes. The most recent risk assessment of air quality monitoring results reported the levels of chemicals on the site are below levels likely to cause health effects. However, it has also been proven that at times levels have reached heights where they could pose harm, and additionally, even if levels are below what is expected to cause harm, this does not mean that harm to health is still out of the question, as it is just a smaller possibility. As the report does not ever state, there is absolutely no chance the level of chemical pollution found during the risk assessment will not have adverse health effects, just that it's less probable based on their assessment. Remember, this document also had an appendix listing numerous substantial limitations, such as annual averages being used versus consistent monitoring of chemical levels. In the limitations, it was also stated that Public Health England were not told the full details of past land use of the site, and as such were unable to comment on the appropriateness of the air sampling undertaken, which is important to note, as it was these air samplings upon which conclusions finding a low risk of health issues was formed. The last limitation of importance is that passive sampling undertaken by the assessors did not reflect short-term concentration of harmful chemicals, including when the site was in operational hours, and admitted that the monitoring technique used to find the data that helped them come to their conclusion does not detail the exact chemical recorded, and thus these were difficulties in understanding the risk assessment of data due to them not being exact. Therefore, any risk assessment made must be taken with a grain of salt, as exact and consistent data was not used. Remember, an air quality expert, Professor Harrison from the University of Birmingham, has said on a national news outlet that levels of some toxic substances released during redevelopment of the site were above safe levels and could exacerbate asthma and lead to cancer. These limitations alone, alongside the fact there was still a chance of health issues, shows how better testing is needed using exact data on the effects on air quality and health of nearby residents. The conclusion that all results for the air quality monitoring assessment of the site are unlikely to pose a risk to long-term health of the nearby population comes with a methodology and risk assessment that suffers from many caveats. Thus, my question is, after reading said report and hearing issues from residents, is how can you, as those in positions centred around representing the best interests of your local residents, continue in your inaction and allow this site to move forward when the report itself has clear issues in its methodology and still fails to completely negate chance of harm to health coming from the development of the site? So I would like Julian Bell to answer the question. Sufyan, can you unmute Mr. Bell?
There we go. I'm unmuted now. Clearly, with any study, be it Araceli's study or public health is study, there are limitations to the data and the conclusions that you draw from it, and public health have been open about that and put that in those exceptions to the report. But their main conclusions and findings are clear that, as I've said, that and as has just been said, that the levels of naphthalene or benzene have remained below the yearly averages and the WHO levels that are considered to be within bounds of safety. Those averages, those yearly averages, those lifetime exposures have not been breached. Yes, there have been occasional short-term breaches, but in that report, there is no likelihood of a toxicological effect on local residents. Now, I'm waiting to see what their latest report says, because that one was based on the data from when the soil hospital was in operation. That remediation of the soil is finished, so I'm waiting to see what their fourth report says, and then we'll see what actions we might be able to take as a result of that.
Okay, right. We've got one last question, I think, from Rhiann Davis. She's going to ask it live. She's here, so if you can unmute her, Sufyan. And then, given the time, it's just left quarter to 9. We're going to have a final statement.
Jean, Sorry, I
Sorry?
didn't catch the name. I didn't
Rianne
catch-
Davis.
Rianne Davis.
Can you unmute, Rianne, maybe?
Yeah.
But then we will come on to a final statement from Cash, which is going to be done by Joe Bangu. And then we're going to ask Julian Bell to perhaps respond to that. I mean, we've had quite a lot of responses about actions that are going to be followed through on this, but that's the kind of end of the meeting, really. Rianne, do you want to ask your question?
Yes, so thank you, Jean. So I'd like to address my question to Julian, and there's some things I want to understand about how the council are dealing with this scheme, which is causing obvious concern to residents about their health and the enjoyment of their lives. And what are the council's red lines in terms of what is and isn't acceptable in terms of a risk to people's health and their enjoyment of their lives in Southall? Could you tell us what those red lines are, how you established them, how you are monitoring them and reporting back? Because all I see is thousands of people saying that their lives are blighted, and the council saying it's inconclusive. So if it's inconclusive, please tell us what your parameters are, your red lines, and how you are tackling them.
Okay, thank you, Ian, for the question. So obviously we have to operate within a framework of legislation on these matters, and what constitutes a statutory reasons for us to issue an abatement notice due to a statutory notice. That statutory guidance tells us that there has to be a likely health impact on residents. Now, our red lines, we have to turn to the experts, both our environmental protection officers within the council, the Environment Agency professionals as they've monitored the site and overseen the soil remediation. And we also have to look to Public Health England, who are the primary body that is there to look after the health of the nation's residents, but also in this instance we referred this to them. So I have to follow and listen to those experts and what they're saying to us, and also work within the legal parameters that exist. If we think that there should be lower thresholds where we could act, then we would have to change the law. And yes, that may be something that, as a result of this, we would look to do. Certainly, I've been looking at whether or not that was possible, and engaging with ministers about how that might, there may be higher thresholds that we could take action on.
Okay, thanks for that, Julian. What I didn't hear in your answer is what your red lines are. How many people should die? How much health should be damaged? I heard you talk about other people. I heard you talk about statutes without naming any legislation. And as you know, I'm a lawyer myself, and there is, of course, there's statutory nuisance, which has no requirement of proof of damage to health. It just has to show that people have had reasonable enjoyment of their home affected, of which you have thousands and thousands of pieces of evidence. And what you've said to me, to be honest, doesn't amount to a hill of beans. There seems there are no parameters set on Barclays Homes and what they can do to Southall. And I have to say, as a white person, I'm asking why you light up the council building and say that Black Lives Matter, and then you let a developer like Barclays Homes access to a BAME community.
Right, can I just intervene here, because just looking at my clock here, Rianne, could I ask you to write those questions down on the chat? Because any questions that are there that have not been answered, we're going to send to Julian Bell and Onkar Sahota and Virendra Sharma for a written response. We find that quite helpful. Can you do that? And there was a request to say, Mr. Bell, could you also perhaps write on the chat those figures that you quoted for the number of complaints over the last, you know, few 18 months or so, if that'd be possible. So can we just move on finally to the closing statement really by Cash, which is Joe Bangu. Joe?
Good evening. Good evening to everybody. Thank you for your time. Cash demands that, can everybody hear me?
Yep.
Cash demands that phase 2 of the development does not go ahead without independent air quality monitoring and proper investigation of health impact. Further, this development is projected to last for more than 2 decades. Our families suffering, and we are not going to go away. We will continue to do everything in our power to stop this environmental injustice and hold those responsible accountable. This includes talking to scientists, academics, and others about the air pollution and health crisis. It includes continuing to collect our own health data and consulting experts. It includes expanding the network of people who regard the management of Southall Waterside development as a gross social and environmental injustice towards a disadvantaged BAME community. It includes presenting Ealing Council to fulfill its duty to residents in the borough. This is a question, Mr. Julian Bell, to yourself. Will you give us your written assurance within 1 month that Ealing Council will meet our demands? No further development of Southall Waterside without independent air quality monitoring through thorough investigation of health complaints. Thank you.
Thank you, Joe. So to conclude, Mr. Bell, would you like to comment on that? Because I think that statement will be being sent to you in writing.
Yeah, sure. So in terms of where we go from here, I've said that we will be instituting that air quality monitoring ourselves as the council from August. That will be done by an independent consultant that we've just asked to do that. In terms of being able to guarantee that nothing, that the works for the second phase can't go ahead, I'm not in a position to give that guarantee. It depends on what the Public Health England 4th report says, which I know people have been asking on the chat when that is likely to come out, and I think it will come out in the next couple of weeks. Yeah, we'll obviously look at that, and if there's evidence there that would mean that we would issue a abatement notice for a statutory nuisance, then we will do so. But if the evidence is not there, then you know, we don't have the power to stop the second phase of the development going forward. But I'm happy to respond to whatever questions there are I'm struggling to put that answer in the chat because I wasn't able to join the meeting on my laptop. So I'm actually on my phone at the moment, and I can't kind of answer questions and juggle chat on the phone simultaneously. But again, I'm happy to send that in a written reply.
Yeah, that'd be fine. That'd be fine. Yes, yes, yes. So I think we've really come to the end of our meeting. So thank you everybody for your time. As I say, we're going to capture all the comments and all the questions and send them to, I think, each of our panelists. We've had a certain number of promises, one of which I think we like very much, which is about the independent monitor. I think that has to be, for me, the bottom line, because that's what we've been crying out for all along.
Jean, sorry,
yes.
Can we quickly just look at Harshdeep Bedi's screen? I believe what she's showing us is the site, if I'm not mistaken.
Yeah.
If we just look at that screen.
Yeah, can you see? There's a video. So we can see here, I think this might be from her house. This is how vast this site is. If people aren't familiar with the site, just have a walk around. It is absolutely vast. And Oliver asked a question about the soil being removed, and I think Julian Bell gave me the impression he didn't know where this toxic soil would be taken, which I think is a bit of a worry. Could it be anywhere? Is this going to be dumped in someone else's backyard? I mean, I think we just need answers to these things, really. Yes, Dr. Sahota.
Yes, I know. Look, thank you. I know this is towards the end, but can I just make one contribution, but for just for a moment? Look, I think we have made some progress. Look, I've been a doctor for about 30 years, and my starting point is, if a patient complains about a condition, I investigate that before saying it's all psychological. I think we really need to get some independent monitoring. We need to get real evidence, and you know, and we don't need. I don't think we need a commission on Berkeley Holmes, right, for an independent contractor. There's the legislation already available. The councils can do this. We must appoint someone with whom we have trust and credibility, and I think Cash should be part of it. Ealing Council should make the decision who to appoint, and let's get some really dependent data. And also then take the point of view: patients are suffering. What can we do to investigate that? What can we do to make sure that we have no stone unturned to help them? That's our starting block, right? Yeah. And everything else is secondary. Thank you.
Thank you, Dr. Sahota. Okay, so I think that probably concludes it. Does anybody else want to make a final? Mrs. Nouri?
Okay. Jean, can I?
Everyone.
Hang on, Mrs. Nouri first.
Yeah, hi, good evening, everyone. There's a couple of things I feel I would like to say, but due to the time shortage, I'm not going to say everything. Just early on, following the point from Julian, that we don't have a powers. But in my belief, as a local authority, we do have a powers. If the people are complaining and there is a problem, an investigation is going on, or on the basis of the pending investigation and complaints by the residents, this development can be held on for the time being. That's the one thing I would like to say. And the second thing I would like to say, of course, in the past, as a Labour Council, as a Labour councillors, everyone worked very hard. We ran campaigns and opposed this development. But unfortunately, it was imposed on us by Boris Johnson. And now, because the life of people is suffering, so we have to take some hard and extra steps in order to make sure that our residents' life is safe and they should not be suffering in the future. And in Southall, you know, mostly it's a 60% elderly residents here. Elderly population, people keep coming daily basis. There's a problem going on. Personally, we have reported quite a few times with the nuisance team as well. And the police have been called on the Broadway, and the river's feeling the smell is coming from the site. So my request is, Julian, as a leader of the council, I think we can do as a council, if the development is causing too much problems, so we can use that complaints in order to stop for the time being. And until we have independent monitoring inquiry set up, we should keep hold on this development, and we should not carry on. And I think that's we can do it. Thank you.
Can I just ask one question? One question I've been meaning to read out. Someone asked on chat, I think, how many Ealing/Southall residents will be moving into Southall Waterside? Julian.
Sorry, who's the question directed at, so I can.
Well, Julian Bell. Yes, Julian.
Julian Bell.
Yeah, so just short of 4,000 homes, 3,750 or thereabouts, are the number of homes. So, the number of residents, it could be 8,000 or again in that vicinity.
But my question was Ealing residents, because I think there is a suspicion based on fact that very few people who've moved into the current blocks are from the local area.
Well, those
who
blocks,
is this development supposed to be for?
So those blocks that have been built, there's a substantial number that are at social rents, and these are genuinely affordable homes, and so those are definitely Ealing residents who have qualified for those properties given their housing need. Can I just say one final thing about the independent monitoring? The monitoring that I'm talking about that will come into play in August is based on the monitoring that you do of vehicle emissions and nitrogen dioxide. It's not going to be monitoring that will look at these volatile organic compounds. That the testing that's been done by Atkins throughout for Berkeley has been done. We have said to Berkeley that they need to continue with that testing through Atkins. And now, if they're willing to pay the council to have some independent testing done, then again, that's something that I will ask them, and we'll see what their answer is. But I just want to be clear on that point.
Yeah, could we follow up with Mr. Sharma's excellent idea that a representative or some representation from Cash be involved in appointing an independent monitor? Because Dr. Sahota has talked about trust, and I think that's a really low level now. It's about people's belief, and people can swap statistics all the time and evidence, but if the trust is dropping. Someone else said that this is going to be one of the biggest environmental disasters. When I first heard about Southall Waterside and the pollution, my first thought was the film Erin Brockovich. If you haven't seen Erin Brockovich, watch it, because I just think this is going to come back to bite Ealing.
So I'm very happy to make that request of Berkeley to involve Cash. So yeah, happy to take up that suggestion by Virendra.
Yeah. Okay, so it's great that we've got 53 people still here. So it's obviously of great interest, of great importance. Maybe one or two final comments and then we'll say goodnight. Maybe Malky would like to, if there's not Malky anymore. Anybody would like to make a final comment?
Can I just make a quick comment? Chair, I don't believe Julian Bell answered your question about how many homes will go to people who live in Ealing. What we do know is that the private homes are being marketed overseas in Hong Kong. Now, an earlier point that Julian made, that he is reliant upon PHE as the health experts, he should be talking to the local community and the GPs based in this area. I don't need PHE telling me that the air pollution has affected my health. I live with it every day. And the best experts on their own health is the local community. I'd also like to reinforce what Rian said, that it's a statutory nuisance, which has nothing to do with health. If I walk into my front room, as I've done on numerous occasions, and it's filled with tar and petrol, that is a statutory nuisance. And Julian Bell, I stood outside of Virendra Sharma's office a couple of years ago talking to you about the odour, and it was present. And you seem to lack complete understanding of what it's like to live with it day in, day out. It only affected you temporarily while standing outside of his office. What is going on is a clear example of environmental racism. And I find disappointing some of your responses tonight.
Okay. Well, maybe we should leave it at that. So thank you everybody for coming.
Jean, sorry, just
Sufyan.
Southall name and shame, I think he wants to say something. So shall I
Okay.
on the floor?
Sure, yeah. One last one then, yeah.
You know, I've been waiting for a while now. Right, so there's a few things that have got my attention. One, and well, a main one has got my attention really. Blair Preach Primary School. Now, obviously, you know that it's right next to the Southall Waterside. We've got kids there. We've got kids in Camargo Primary School. We've got kids in local schools around that area that are breathing in and out that toxic air. You've got people in lockdown, during lockdown, that weren't able to go out, but unable to stay in their homes because they can't breathe in their homes and they can't breathe out their homes. But we're stuck with a situation that we don't know what to do anymore. In Southall, and then you got Julian saying, oh yeah, 83 people complain at a certain type of certain period, 73 people complain about a certain type of period. That's fine, but then have you ever noticed that how long people have been complaining for? And then when they're on the phones waiting on Ealing Council, it's over 45 minutes of waiting for someone to answer a call. Or even if, as even Angela said it, you can be online. There is no support online to help you. So we need to adjust the online services. We need to make a separate line services just to know that this is an issue. But it seems like that no one's bothered. Now, I've seen it that, Julian, yes, you said that you're going to do as much as you can do. I see Sharma saying, yes, he can do as much as he can do. But are you? Are you really? It's taken you how many years? And now you're, as even David, obviously I've seen quite a few comments. Now you're writing letters. Now you're getting involved. Now you're going to do it. Well, what about then? Did we not care then? How come now you're caring is because you've been on BBC News. Now the Guardian's on this. Now we're really pushing hard onto you. You know it. We are all pushing hard against you, and that's why you have no room to breathe yourself, because every step that you go, every step that you make, we will always be around you to push in and question every single little thing that you come up with. Like Sharma, you said that, oh yeah, if we can get someone to help us out, Barclays will pay it. Well, can we have that also in writing? If Julian Bell is going to actually do that, can we have it in writing as well from you? I know you're really bad at writing a letter and writing it and getting it responded really quickly as you possibly can. But obviously, we'll expect one of your colleagues to obviously write a letter with your signature on your behalf. But are we ever going to get anything done? Are we ever going to see anything? And as even here, I've got a comment here. We all know that you guys are directly in line with Barclays. We've seen it, we've heard it, we've known it. There's no point sugarcoating it. We might as well put it out there. We all know it. But all we're asking is we all need a place to breathe. And we're not getting that. And also, another point, residents are not actually living on Waterside, because actually on JLL Estates, who are a external estate agent who does international estates, are going for our properties for $395,000 and more for Waterside properties. What's your question on that? What's your answer on that one? Did you know that JJL investments of estate are actually involved in this? You said, oh, we don't know anything about it. No, you do now. How come no one knows about it? How come we have to do independent searches, but you guys can't? So you got Sharma, you said you're part of Southall, you're here to help Southall, but why are we doing your job? Why are we researching for you and then questioning it and saying to you, can you do this? When it should be, I've spotted this, I've seen this, I'm going to do this. Julian, same thing. Why are we doing everything for you? But then again, you question it at the time of when we ask you, thank you for bringing it up. Well, we brought it up 3-4 years ago. And then you can't blame FM Conway because FM Conway has been here longer than Berkeley's. So where was the smell before that then? They've been doing it for years. I've been living in Southall about 16 years now. I live in Norwood Green now and I can smell it from there. It's just getting ridiculous. People need a bit of space from this. But I want to hear what you guys say about this.
Right, thank you, Southall Name and Shame. Quite a powerful thing maybe to end on. I think things are becoming clearer to everybody. People are becoming more and more interested, more on the ball. As Joe Bangu said, we'll be carrying on our own research, talking to people, academics, the media. This is not going to go away anytime soon. Okay, so thank you very much for coming. And Sufyan is the host, so he will
just a final word. If anyone wants to be part of, like, well, not the mailing list, but like any answers, the questions we've been asked, if they want the answers, what I'll do is I'll send it from the cash email address. If you just email the cash campaign email address, which is cashcampaign786@gmail.com, and just say you came to the public meeting and you want the follow-up. And when we get that follow-up from the councillors and Julian and Virendra, we will then pass it on to yourselves. And yeah, I just want to thank you all again from coming. And as a youngster, obviously, this is my home now, and it will be for a very long time. So I want this issue to be nipped in the bud now rather than later. So again, thank you for coming.
Thank you. Thank you. Bye-bye.
Thank you to Jean, the chair.
Pleasure. Okay, bye.
Bye-bye.
Bye-bye.